Welcome back. My name is Matt Reiners, and I'm the co-founder of Eversound, a company dedicated to improving quality of life for older adults by giving them the gift of hearing. Today, I'm joined by Dr. Buffy Lloyd-Krejci, the CEO of IPCWell. She is a best-selling author and one of the foremost authorities on infection prevention and control in nursing homes and long-term care facilities. Thanks for joining me today, Dr. Buffy.
Thanks, Matt, for having me. Happy to be here.
Yeah. So, Dr. Buffy, can you share a little bit about your background and how you got into this space?
Yeah, sure. I mean, I never set out to really do what I'm doing today. I don't know if any of us do. But really my journey, I've always had a passion for helping people. My journey even started with my own grandparents when I was 19 years old. I helped navigate their end of life care in nursing homes. And then really through the course of my life and education, have worked in hospitals and through public health over the last 25 years. I have such a passion for long term care. I think in part due to my experience with my grandparents, but also that this is such a vulnerable population and is often ignored that I'm just very captivated by the long term care industry. And I completed my doctorate in epidemiology and public health, really determined to prevent infections and harms for those that are needing care in an institution like a nursing home or long-term care facility. And that has pretty much where I've come from and why I am doing what I'm doing today.
That's awesome. Well, we're happy to have you in this space and doing the forward-thinking work that you're doing because I feel like without people like you, we'd be in a much worse spot. So thank you for that. As part of your book, which I will link to the comments here, I noticed as part of that journey, you visited, 200 nursing homes. I'm curious, what did you see?
Yeah, while everybody was binging on Netflix, I was out in the middle of the pandemic, supporting nursing homes. I worked with Doctors Without Borders, their first US-based mission in Detroit, Michigan, and Houston, Texas. And we really were engaged in helping the nursing homes mitigate and contain COVID-19. Really, and that's really what sparked me to write the book Broken, is because I really wanted to give the public an understanding of what really is going on in nursing homes and in a sense of the challenges that they face. Oftentimes we hear the worst of the worst and we hear this horrible, situation that's occurred on the evening news. But I wanted to maybe pull the curtain back a little bit and highlight the heroic staff that show up every day that are dedicated, that are truly committed to delivering high quality of care, and how it's really the way the system is set up and the infrastructure of our long-term care, or fractured system, I should say, that actually often prevents our dedicated workers from delivering that high quality of care that they so desire to. And so really just wanted to really highlight them and tell their story. Is It's a book about, it's really a lot of interviews with staff and with also academic researchers and people within the industry, and to tell a different story that many people don't really understand or know.
Yeah, I think, the general public are always seeing, the terminology, if it bleeds, it leads, right? We always see the negative press and
Right.
negative headlines, especially during the pandemic. And yeah, and that was, inspiration to start this podcast because I saw some of the amazing things that were happening and wanted to try and put a spotlight on that. And, it sounds like you're doing that too. And, you'd mentioned the staff and doing some of those interviews. And I'm curious, like, how did you see them respond to what was happening out there?
Well, you have to understand it's human beings that are working in healthcare just like, any other field, and we're not robots. And so a lot of facilities lost a lot of staff if they had an outbreak. They were afraid of potentially getting the virus and bringing it home to their loved ones, especially if they cared for elderly loved ones in their own home, which is often the case. And so oftentimes you had a very, very thin margin of staff working. And then And, so they had the fears and they had all of the emotions that go along with that. And then also not having what they really needed to fight this enemy, this unforeseen and you can't see COVID. And so it was a very challenging time. But I'm telling you, some of the most incredible acts of service that I've seen, you know, joining together, working together at a team. You had your and some, administrators in the kitchen cooking for the residents. It was a full on team effort. It had to be. And for those that I just what I saw was such an incredible act of heroism and commitment and dedication to ensuring that our loved ones were still able to get the care that they needed. And
Yeah.
there was a lot of mistakes along the way. There was a lot of challenges. We know that, but overall, it was very captivating for me, and that's why I knew I needed to write and tell the story. And I also want to mention they also had a lot of extra pressure coming from the licensing and regulatory division when all other state surveys were halted. The long-term care nursing homes actually had targeted focus that became very nitpicky and very detrimental, I will say, to the work that was being done. And you can read more about that in my book, how it actually was causing more harm than helping. And that was just one more layer that our staff had to deal with while they're dealing with this, worldwide emergency that they were.
Right. Yeah. No, I'm excited to read it. Um, we talk about the positive things that were happening, and I imagine too there was some other things, and you talk about the added layer of regulation there. But what did the pandemic uncover about the nursing home system?
Yeah, I think what we really see again, I don't think we highlight the staff enough. There's especially right now, there's so much advocacy happening, and I'm so happy about that because it's really past due. We need this. We need to advocate for support and help with to make this industry stronger. And I just feel like it's kind of been a forgotten healthcare sector as well as the staff. And so my biggest platform is advocating for the staff. We cannot even possibly talk about high quality of care for our vulnerable loved ones if we're not providing high quality of care and support for the staff that deliver that. And so that was one of the biggest areas that I highlighted. The conditions of having maybe one nurse to 20 residents. That's we've got to do better than that. No matter how good you are as a caregiver, you can't possibly deliver quality care to 20 people in your shift. You know what I mean? And so we have to really look at the processes that are in place and begin to look at how we can implement better practices that support our caregivers in order to support our loved ones. It has to happen.
Yeah. Yeah, absolutely. I think it's this recurring theme I see, but I don't think a lot of people understand it. That you got to take care of the staff first, and everything else kind of falls into place. And if you're not doing that, nothing else could be expected, and really just setting up people for success. Because in some of these situations, we're just setting them up for failure, which is unfortunate. And now, what do you think the long term industry needs to do as we are in this post pandemic world? And granted, I know breakouts are still happening, but to best care for our senior population.
Yeah, I mean, it again goes back to the staffing, but we also, have to invest, especially when it comes to infection prevention and control. That's my specialty. We have to make this a priority. Before the pandemic, there were an estimated 1 to 3 million infections occurring in this healthcare sector annually, leading to 380,000 deaths a year. That's over 1,000 people dying every day from infections in the long term care healthcare sector. So we need to invest in robust infection prevention practices and dedicated staff. So every long-term care facility, skilled nursing facility has to have now at least a part-time infection preventionist. But what I'm seeing with the staffing shortages is sometimes that's just on paper only. So we have to invest in this infection preventionist to do the job that they are trained to do and provide the education to prevent outbreaks. People are aware of superbugs, MRSA, we're aware of that, right? The C. diff, other multi-drug resistant organisms. W- we do not want our loved ones dying from an infection that we give them as healthcare workers, right? So we must invest in this in infection prevention practices. And also, I think again, we need to provide a more of a living wage. We need to provide more training and support within the industry, and to really develop that so that we can deliver that high quality of care. And we need to make sure that the frontline workers are the ones actually being compensated, that the funding doesn't get filtered up and out. So that's also something very important that has to happen.
Yeah. Yeah. Makes sense. And, you know, one of my favorite questions and my final question here for you, Dr. Buffy, is if you were to give other providers or, healthcare companies just three guiding principles as we were to move through the rest of 2023, what would you say?
Well, number one, it's all about relationships. And, especially in long term care. If you're not in it for the right reason, go into banking or something. It's all about relationships and it's critical. And, having that passion. Also to have hope that that it is possible to change. And there are a lot of good people that are really dedicated, such as yourself, that are bringing awareness to those best practices. And I would just say the third one is, to understand not only the healthcare workers' needs, but the consumers' needs. And I'm actually writing a follow up book now that's directed just towards the consumers and actually how to navigate the current system that we have and highlighting best practices that we have. So we need to understand the consumers, where they're coming from, what they need, because we're all consumers, right? All of us are. But understanding those needs as well as the needs of the healthcare workers and what's needed in the healthcare sector, and try to bridge them together so that we can have the best possible solutions for the entire environment.
Wow, love that. So many golden nuggets within there, Dr. Buffy. And I'll put a link to your book in the comments here. But thank you so much for your time here today, and thank you so much for all the positive that you're bringing to the world. So thank you.
Thanks, Matt. Thanks for having me.